Coming out of a regional symposium on violence in the Caribbean, looked at in the context of a public health problem, Prime Minister Dr. Terrance Drew confirmed that actions to follow will come through CARICOM. While not giving details ahead of the release of the Communiqué from the CARICOM Secretariat, Prime Minister Drew expressed the view that handling the violence issue in the Caribbean could be most effective if done from the level of the Caribbean community. Prime Minister Drew was responding to the news media immediately after arriving on St. Kitts from Trinidad and Tobago, where the symposium was held.
Yes, we have come up with a number of common things that we'll do. Why? CARICOM has three fundamental pillars, and we are adding the fourth one. When that is done like that, it means that CARICOM now would be asked to come up with action plans. With action plans, of course, implementation. But outside of that, to get the funding necessary. Just like how we have done across the region with other type of program. For example, HIV/AIDS was not handled by one country, was handled by CARICOM, and it's a huge success. NCDs, non-communicable chronic diseases, is now being attacked from a CARICOM level, and the resources flowing into the CARICOM is helping each country. And we are saying if we have been successful dealing with critical matters that affect all of us across the CARICOM, why is it the violence is an issue that is affecting all of us? Why not come together and come up with common sense policies, scientific based policies, and get the resources to implement measures to deal with it? So I'm very, very hopeful, and so you'll see a number of those things come out in the communique.
It was the first time that violence in the Caribbean was discussed at high levels in the context of a public health issue. Glenn Bart reporting for SK Newsline.